Good evening, ladies and gentlemen. Can everyone hear me? Yes? Okay, great. My name is Hisham Hamouda. I'm an assistant professor at the Harvard Medical School. I'm the vice president of YICAPAP. It's a very long acronym, the International Association of Child and Adolescent Psychiatry and Allied Professions. It's really an honor and privilege to be with you today. It's rare that I get an opportunity to speak to as many teachers. I do a lot of work with teachers. I have an interest in school mental health, and a lot of what I've been presenting today, what I presented earlier today and presented yesterday in a full-day symposium, is from work developed by the World Health Organization that I helped develop for them, along with a wonderful team of people. Another reason I'm really glad to be here today is this. I would probably be in Boston doing this right now if I wasn't here. So it's another great reason to be here today. These are some of the names of the people who. Oops, I'm sorry. I'm just getting to learn how to use this. Some of the people who helped develop this program. So Dr. Khalid Saeed is the regional advisor for the World Health Organization in our region. Many international experts, a few from the US, from the UK, as well as many regional experts. So children are the messages we send to a time we will not see. Investing in children is really an investment in our future. So the WHO defines health. How does it define health? It defines health as a state of complete physical, mental, and social well-being. And it's not merely the absence of disease or infirmity. Indeed, there is no health without mental health. We know that 1 out of 5 children, think about this number, 1 out of 5 children suffer from a mental illness. So if you are a teacher and you have a classroom of 20 children, 4 of the children in your classroom could be diagnosed with a mental illness. We also know that about half of all mental illnesses start during the adolescent phase, under the age of 14 or 15. 3 out of the 10 leading causes of disability worldwide are mental illnesses. And we're talking about all diseases that exist, things like cancer, heart disease. 3 out of the 10 leading causes of disability are related to mental illness. Effects can be lifelong. Development, academic attainment, and unemployment, crime rates. So there's a lot of things, societal problems that are also related to mental illness. Suicide is among the leading causes of death among adolescents. So if you think about when adolescents die, one of the leading causes of death in this age group is suicide. Many of you from the region would think, well, this is not a problem that we deal so much with in our region. But having practiced both in our region and in the United States, it's still a very significant problem even in our region here. And I will get the chances to show you some of the numbers later. Mental and substance use disorders were found to be the leading cause of illness of years lived with disability. It's a specific term that is used by the World Health Organization, years lived with disability. What does it mean? You're still alive, but you live with a disability. Why? Because mental illness hits really early, and it hits hard. It hits people at the most generative phases of their life, beginning of their education, beginning of entering the workforce. So it hits early, and it hits hard. Prevalent rates of mental disorders among children and adolescents in the context of emergency situations in our region. So these are statistics from our region, some of the countries that are witnessing emergency situations, and unfortunately there are quite a few of them in our region, whether Syria, Palestine, Yemen, Libya, Iraq. There's a lot of unfortunate wars and calamities going on in this region. Numbers here are about 24 to 54%. 22, sorry, to 54%. And these are from the World Health Organization statistics. What is the global cost of mental illness? $2.5 trillion in 2010. Just think of this number, $2.5 trillion. So we also know that our region has a very young population, one of the youngest populations in the world. If we think about the population pyramid, this region is actually the perfect pyramid. The base is the largest sector of the population, and it's less and less as the age grows older. So this is both a challenge, but also an opportunity for all of us to reach these people early on, help them with prevention and promotion efforts, but also with identification efforts of those struggling with mental illness and how to support them. So we have a high percentage of our population under 15 years of age in this region. We're just talking about the EMR region. Just for definition, so the EMR, so the World Health Organization is a UN agency, so it follows the definitions of other UN agencies in terms of distributions of areas. So the EMR is basically the Arab world, but it's the Arab world with the exception of Algeria. Algeria belongs to Africa for more or less political reasons within the World Health Organization structure. But we also have, in addition to the Arab region, Iran, Pakistan, and Afghanistan. So these are kind of the statistics that represent this region as a whole. But it's mostly the Arab world. It's about 22 countries that fall under this region. So we have a high percentage of the population under the age of 15, about 34 to 50%. 40 to 50% of the population is under 15 in 7 of these countries. Imagine, 1 out of 2 people is under the age of 15 in 7 countries in the region. I think Yemen is the country with the youngest population in the entire world, even above 50%. High numbers of countries with increased risk factors in the region. We mentioned wars as being one of them, but also high percentage of low and middle income countries in our region. 15 of the 22 countries in our region are considered low and middle income countries. Basically, the Gulf region is in the upper income bracket. Okay, so these are percentages from the CDC, Center for Disease Control. So these represent US numbers. I don't see the pointer. Can anybody see it? I don't see it. No? Okay. Well, in terms of percentages in the US, about any disorder is about 13%. There is some variability between countries. So as I said in the beginning, the number we cite in general is about 1 out of 5. This is a 1-year, 12-month, 1-year prevalence. The 1 out of 5 is more of a lifetime prevalence for during the entire phase of children and adolescents. So the number of any disorders in the US in 1 year is 13.1%. Some of the most common things are ADHD. We usually cite the number between 8 to 10%. So again, if you have a classroom of 20 students, 1 to 2 of the students in your classroom have ADHD. That does not mean they're being treated for ADHD. That does not mean you know they have ADHD, but they have ADHD. Other things like mood disorders, things like depression, and other less common things like bipolar disorder, so major depression, conduct disorders are quite common. Dysthymia. Dysthymia is a form of depression, but it's a more permanent form of depression. These are people who are just not happy most of the time. And then anxiety disorders, panic disorders, generalized anxiety disorders, and eating disorders. Our region has one of the lowest percentages of eating disorders, but it's going up a lot in an alarmingly high rate. So in general, for most mental disorders, the numbers, there is some variation across the different regions, but the numbers of most disorders are pretty similar. Things like ADHD, schizophrenia, bipolar disorder. One of the things that does vary a lot by region is actually, substance abuse does vary a lot by region, but also eating disorders. We used to historically think of our region, the Arab world, as a region that does not have eating disorders, and that it is a disorder of, affluent Western countries. And it has been proven that actually it is a disorder that has a very strong cultural influence. So there were studies done at Harvard University looking at remote populations in the world, like endogenous population in Papua New Guinea, which is a small island a little bit north of Australia. And these were tribes that are almost disconnected from the world. So they don't have TV, they don't have electricity. And this disorder does not exist. There is no eating disorder. And by eating disorder, for those of you who are not familiar with it, we're talking about things like anorexia nervosa or bulimia nervosa. We're not talking about somebody who loses their appetite for some reason. We're talking about disorders that are relatively chronic and a lot of times life-threatening. Anorexia nervosa is one of the disorders that has the highest mortality rates among mental illnesses. So they found that in Papua New Guinea they did not have these disorders, and we thought that in our region it is pretty similar, which is true, but we're also seeing a very big increase. So although the number is small for eating disorders, it's increasing rapidly. And people believe it is because of the influence of things like TV, Western media, the kind of McDonaldization phenomenon of the world. We all live in a global village, and teenagers are subjected to the same influences related to body image, related to the ideal body image. And this is a disorder that's predominantly in females, although it is 10% can be in males, but predominantly in females. So although it's something that is not very common in our region, it's something that is increasing more and more. So the percentage of people who actually get help. So we talked about these scary numbers. 1 out of 5 people have mental illness. And this is, again, statistics from the US, from the CDC, Center for Disease Control in the US. We see that about 50% of people get help in the US. And if you look at these numbers for different disorders, you'd notice an interesting phenomenon. The people who get help are the people who mostly have what we call externalizing disorder. So someone like ADHD, the hyperactive child who could be disruptive in your class, is much more likely to get help than maybe like a 10-year-old girl who is shy, is anxious, and sits in the back of the class. Makes sense, right? As a teacher, as an educator, we notice more people who are acting up. We notice less people who are withdrawing. So ADHD is one of the things that gets more treatment. Conduct disorders, again, these are the children who do not listen, defy authority, sometimes get involved in things like fire setting, destruction of property. So it makes sense. They get people's attention. And then they get help. But even so, even in the US, one of the most advanced countries in the world, less than half of the people get help. I wish I could present for you statistics from the region. The answer is we don't know, but we think the numbers are so much lower. If you think about any, for those of you from the region, worked with some of these kids, if you think about the percentage that gets help, I would think it's so much lower than 50% that we see in the US. Okay, so these are some of the statistics from the region, and unfortunately we do not have a lot of statistics from the region, but this is the Global School Health Survey that is also conducted by the World Health Organization, I think together with other organizations. But we actually have some statistics from Jordan. These are not statistics about disorders, but just they ask certain things about like hopelessness, if you've thought about suicide, friendships and stuff. So look at this, because a lot of times I get people who say, well, suicide is not really an Eastern phenomenon. It's not something we see, in this region so much. 16.6% of your students in Jordan, for those of you from Jordan, have considered suicide. Now, I have to say this number, although it's high, it is lower than other countries. And I mind you, this is considered suicide. This is not suicide attempt. Considered suicide as somebody who at some point thought about ending their life. This number in high school students in the US is about 40-something%. But it's still scary to think of it. About, almost 1 in 5 students in Jordan have considered suicide. And having practiced both in the Middle East and in the West, we certainly have seen a lot of, even working in the emergency room as part of my training as a doctor, you see a lot of people coming after, suicide attempts. The reason we think the numbers are lower, one is religion. So Catholic and predominantly Muslim countries, because suicide is considered like an eternal sin, the numbers are lower. But what we see in the region is that there are a lot of suicide attempts, or what we call parasuicide, so self-injurious behavior that may not lead to suicide, but also a higher number of people who take do higher risk-taking behavior. So this may not be a person who necessarily wants to kill themselves, but this could be the teenager who takes their dad's car, uses some drugs, and drives at 120 kilometers per hour. So while they may not be intentionally trying to kill themselves, we call them they're passively trying to kill themselves. So I'm just stressing this point because this is a problem everywhere, and it is a problem in our region. And suicide is one of the few things in mental health that actually kills you, right? I mean, you kill yourself. You can have depression for a long time, but if you're not suicidal, you're probably going to stay alive. Suicide does kill people, and it's a problem that we should be aware of, and it's a problem that we should know that also exists in our region. Okay, so this one is also epidemiology from the region. Unfortunately, I don't have numbers about Jordan, but if you just take a minute and look around the region, look at Palestine. 42 to 48% of children have some disorder. Of course, a very high prevalence of PTSD. I saw some studies from Gaza saying that 40% of school children have post-traumatic stress disorder. imagine, this is like 1 in 2. 1 out of 2 children are traumatized. Let's speak dollars, or let's speak money. So we said $2.5 trillion were spent in 2010 related to mental illness. Let's look at some of the numbers. In the UK, preventing conduct disorders in one child through early intervention has been found to result in a lifetime saving of £230,000, equivalent to about $347,000. Think about this number. Helping one child with conduct disorders would save you $340,000. Probably most of you are looking at this number and like, there's no way this could be true. But I'll tell you how they come up with these numbers. So a child with a conduct disorder, if they don't get help, what happens? They grow up. A lot of times they develop criminal behaviors. So this number factors in things like, health costs, but also these people, they might be using drugs. These people might be committing criminal offenses. These people are probably not working, so it's lost income and lost money for society. These people could be in jail, and we're spending money keeping them in jail. So this is a big number, but we are saving a lot of money. I mean, the question here, the real thing I'm trying to convey to you guys is that any money we spend in child development programs, parenting programs, mental health program, is money well saved, because it will save you a lot of money in the future. And when we advocate with politicians, we try to show them this number. And my experience is that politicians, when you talk maybe about percentages, you talk about it's difficult to have depression, suicide. They nod their heads, but they really react more when you talk about numbers. So these numbers are very important to present to them. I think the challenge with numbers is that politicians, people in power, usually think about it a little bit different. Although it does cost $347,000 to society for a child with a conduct disorder, they calculate it a little bit different. They're like, well, but I need to invest money to treat them now, while the conduct disorder, by the time it actually costs society money, by the time they have criminal behavior, are in jail, someone else would be elected. Hopefully it's less of a problem in our region, because their leaders continue for longer years. But it's usually a problem when speaking to politicians, because they want programs that save money today, so that they're able to show that we're saving money, we're doing this and that. Let's look at other countries. So in Canada, in a Canadian province, they did a statewide, province-wide study that showed, looking at triple P programs, so positive parenting programs, for those of you who are familiar with it. It's worked mostly with the parents around parenting. Showed that the program had the chance to avert 26% of cases of conduct disorder. By intervening with parents, they were able to prevent 26% of conduct disorders. And it only took 1.6% of cases to be diverted for the program to pay for itself. So if you are working with 100 children, and you only help 1.6%, like almost 2 children, you've already paid for the cost of the program. And most of the programs are more effective than 2%. Like this program helped 26%, despite that even conduct disorder is one of the least disorders that respond to any intervention. So, hopefully with these numbers, we all understand that the economics of mental health also does work. By helping people and by intervening, we actually save a lot of money. We save a lot of other issues. Crime, unemployment, school dropouts, a lot of things. Okay, what about the US? Improving a child's mental health from moderate to high has been found to result in $140,000 lifetime savings. And again, this is things calculated based on income earned in the future. So helping people with their mental health makes a difference. So what if we don't? What is the cost of doing nothing? Which is really the case in a lot of countries. A higher education cost, right? So the children are not getting the right intervention. It costs more to educate them. Lower graduation rates, higher dropouts from school, increased use of expensive tertiary mental health services. If we don't implement prevention and promotion programs in schools, guess what? We're going to have to deal with more sick people in the future, and it's still going to cost the society more. Increased health care costs in general, increased number of children in the juvenile justice system, and other out-of-home placements. So children, in the US we call it DYS, Department of Youth Services. In Arabic we say Adhd, right? I think we probably use the same term here. So children who are not getting help, particularly ones with conduct disorders, could end up more in the criminal system if they're not getting help. And it's still much more expensive to deal with them there. And suicide is the third cause, leading cause of death among children, of all causes, all illnesses. So let's talk about schools, because the idea here is what could we do for schools? And this has been kind of the focus of some of the presentations that I've had earlier today and yesterday, is what could we be doing at a school setting? So the World Health Organization program that I'm talking to you about, we're about to pilot it in 6 countries, and our goal is that eventually it would reach all the countries in the region. But the idea of it, a lot of it is about prevention and promotion. What could we all do in a classroom setting to help children have better mental health? So this is not just about helping children who already have a mental disorder, but helping people maybe not develop a mental disorder. Or for people developing a mental disorder, can we identify them earlier and intervene earlier to be able to help them? So schools have a great opportunity not only to identify and support children experiencing emotional and mental difficulties, but also to promote overall emotional and social and moral development. Schools are imperative in mental health promotion and prevention. This is the best place to reach people. As a psychiatrist, a lot of people come to my office and have a very busy practice, but I also know that a lot of people would have liked to have treatment, but still have a problem coming to my office. So what if we were able to reach out to those people, whether through prevention and promotion efforts, but also through early identification and intervention, and having actually mental health services administered at schools. School experiences are vitally important in both children's intellectual development and their psychological well-being. There is a close connection between emotional health and academic achievement. Children and adolescents who experience positive emotional and social well-being report greater satisfaction with their family and their relationship with friends, so it affects the social domains. Effective social and affective education is directly beneficial to academic achievement. So we are not coming to teachers and saying, we know that you guys are already overworked, overstressed. This is just an additional thing. Worry about their mental health. No, this is in the core of what you are all doing. For your children to do better academically, they have to be in a better state of mind to be able to learn. Even in developed countries such as Canada, a need was found to have more effective teacher training about mental health and having a lot more proactive approach toward mental health in schools. So improving academic achievement makes sense, but there's really a lot of empirical support for it, a lot of studies that support that. Children's well-being is linked to their academic achievement. Student effort is highly correlated with more positive academic outcomes, right? If you feel better, you work harder, and your outcome is better. It makes sense, right? It does make sense. But there's also research and science to prove that. School programs that focus on social, emotional, and academic learning have been found to improve school attitudes, behavior, and academic performance. Social development. A lot of the social development happens at school. A lot of the meaningful relationships we develop happen in school, whether with peers or with adults. Think about your own experience as a student. Think about middle school, high school. Think about how many friendships you made and how many you may have even maintained into your adult life. Think about your teachers. I'm sure everyone could think of a certain experience they had with a certain teacher that totally affected their life. I'd hope in a positive way, and that's mostly the case, sometimes also in a negative way. Something someone told you that really changed your life. Someone who held your hand. Someone who told you you could do it. Someone who told you, I believe in you. We all think about these things as just part of our daily life. We're teachers, we talk to a lot of people. One word you could say one time could change someone's life forever. So think about how germane that is. Think about how important that is. And sometimes something you don't say can affect someone's life forever. Sometimes something you say you wish you did not say can affect someone's life forever. So keep that in mind. Strengthening students' protective factors and resilience reduces negative impacts for vulnerable children. So let's think about abuse. Children who suffer from domestic violence, domestic abuse, whether emotional, physical, or even sexual. Think about school as a healing environment. Think about their life at home. And then when they come to you at school, think about the impact you could have. You may not solve all their problem, but you may be the difference in having this child have some stability in their life moving forward, or totally losing it, getting into drugs, getting into criminal activity. So again, schools have a big role to even mitigate things that happen outside the school setting. Promoting school mental health helps decrease violence and juvenile crime, as we mentioned. Schools play a significant role in early identification of children with mental illness and also in altering the school experience for these students. So identifying people early and creating an environment that helps support them moving forwards. School is a more familiar and less stigmatizing or threatening environment. I mentioned this before. It's so much easier for us to reach people at schools than wait for them to come to see a psychiatrist. There is so much stigma, even in the West. But stigma here, again, having practiced in both worlds, is so different. It is at a different level. I mean, having someone take their child here to see a psychiatrist is really a big deal. I had a colleague in the US who was practicing in Saudi Arabia before, and he told me there was a very interesting phenomenon. So in a mental health clinic for children in Saudi Arabia, the parents would come covered up. So, ladies cover up in Saudi Arabia, we know that. But men would come covered up. They would cover their head with, I think they call it al-ghutra. They would cover their head, only their eyes were shown. The parents, the dads were scared if someone identified them there, they would be stigmatized. Their family would be stigmatized. So just imagine the messages this sends to the children. If you go and your parents are hiding their face, that's the ones who even made the effort to take you. A lot of them would not even take you. So just think about that, and then think about this, the opportunity this gives us to reach students at school. This is another good reason why we should intervene for the teachers' mental health. I'm sure many of you have felt this way at some point. So working with children who have mental health problems can be very challenging and stressful for teachers. So I don't have the exact reference, but I've seen a study before that looked at teachers, asking teachers, about burnout. Teachers who stop being teachers, or teachers who burn out, who cannot be effective teachers anymore. Asking them what are the factors, right? So of course, you could think of a lot of factors. Sometimes financially being a teacher could be challenging. Sometimes you don't have the resources. But what was the number one factor that actually led teachers to burnout? Students having difficulty in their class, difficult students. And a lot of difficult students are students who have mental health challenges. So think about this. We're not just doing this because it's the right thing to do, ethical thing to do. We're not just doing this because we want students to learn better, but we're actually doing this also for the teachers. Enhancing student emotional health can improve satisfaction and retention among teachers. Schools influence the adoption of both healthy and unhealthy behaviors, right? If you think about things like substance abuse, many people start using stuff in, the school bathroom or something, right? It's very common. But also very positive behaviors like exercising, healthy eating could happen at school and could be promoted in a school setting. Children often establish deep and lifelong relationships with teachers, school staff, and peers at school, as we mentioned before. Children learn to express themselves and actively participate in social activities at school and community projects. Okay, so I hope I've made a case for why this is important. And sometimes I feel a little bit silly for spending so much time to make a case for why this is important. But we have to make a case for why this is important. Because this is a problem. It's a problem in our region. It's a problem everywhere. And although people nod their heads and think it's important, they don't truly sometimes believe it's important. So I hope we've made a good case for why it's important and why schools are a really good place to actually do some of these efforts. So I wanted, in what's left of the time, to maybe talk a little bit about the characteristics of a good teacher and a characteristic of a good school, and some of the health promotion and prevention efforts that could be done at school. Mind you, this is, of course, a huge topic, and we can spend hours and hours talking about it. And the program we developed for the WHO that I've been talking about all the time involves a lot of different sections, but a lot of it does focus on prevention and promotion. And some of what we're going to present is from that program. So what makes for a good teacher? A lot of things, a lot of factors. But things like understanding development, children's development, different stages, and also what are the age-appropriate interventions at different stages. Being empathic, really caring about people's feelings. You know, we don't have to always agree with people's feelings, but there's no reason we cannot empathize with even feelings like anger, sadness, anxiety. There's nothing wrong with saying, I see that you're angry, what can I do to help? Right? It doesn't mean you even agree, because sometimes the reason they're angry, the student may be angry, is not something you agree with. They could be angry because you're giving them too much homework. But identifying their emotions and acknowledging their emotions and thinking collaboratively of how to help the student move forwards is really important. Being attuned not only to verbal cues, but also nonverbal cues. We communicate a lot with our body posture, with the way we talk, with our eye-to-eye contact, or the lack of, right? If you don't look people in their eyes as a teacher, the sense they probably get is that, you know, you're just not interested. You're just like doing your job, like you don't really care about them. So a lot of the nonverbal cues make a big difference. Communicates effectively and clearly. Makes expectations about child's behavior clear. You know what is expected and you make these expectations clear. Arranges not only the physical environment, but the interpersonal environment and even the emotional environment in the classroom to help support the learning process. So what makes for a good school? We talked about a little bit about what makes for a good teacher. Of course, there are a lot of other factors. Maybe what I'm focusing on here is more, you know, from an emotional perspective. What makes for a good school from an emotional perspective? Caring relationships. Staff is involved in decision making. The staff feel empowered. The whole school environment is empowering. If the teachers do not feel empowered because of the way the administration is structured or the field they have in making, that their voice is heard within the school setting, being able to make decisions, if they don't feel they're empowered, do you think their students are going to feel empowered in the classroom? No, this will trickle downwards. So the culture, and we know this being true of a lot of places, right? We know that, we talk about corporate culture. There's people who spend their whole life studying corporate psychology. What can I do in a company to make, people who work there productive? And I'm sure the same is true at school. There are interventions, there are things we could do that can make the environment better for the teachers, but also for the students. Partnership between schools and families, and I could not stress this more. Approaching education as really a team effort, as opposed to something that just happens at school, or parents having to sit with their children and do their homework. But this is like a collaborative effort, working together, not only on academics but also on emotional health. The physical and interpersonal environment are safe and orderly. I think this is self-explanatory. Students are diverse. I really always struggle with this point. Again, a lot of times I reflect on my experience being a student and early on maybe a teacher in the Arab world, and then moving to the West. So we have a lot of diversity too in the Arab world. But a lot of times I struggle when I ask myself the question, do we really appreciate this diversity? Do we really help to promote this diversity? And I'm not here to discuss politics or world affairs or philosophy or anything, but let each one of us ask this question to themselves and think deeply about it. Do we really appreciate diversity? Do we really appreciate why students being different in any way? They can be different, their race could be different, their socioeconomic status could be different, their religion could be different, their color could be different, all various things, their disability status, having students with disability in the classroom. Do we truly appreciate this diversity, or do we perceive it as a burden? And when there is this diversity, because we also live in a region that is very diverse in a lot of ways, do we really help people who would consider themselves minorities of any kind to feel that they're appreciated and that what they bring to the table is appreciated? I have questions about that, but I'll leave it for every one of you to think for yourself about the answer. Strong leadership, obviously, in schools is very important. Cooperative learning and proactive classroom management. Rules and limits are clearly defined and fairly enforced. I love policies, and one of the things that we sometimes perceive as a burden is feeling that there are a lot of policies, but policies do help, right? Because they help in a lot of ways. They help people to know what to do, but they also help propagate the sense of equality. If you have a policy about bullying, even a written policy, like what do you do when there is a situation of bullying, or any other examples for policies, that helps when you implement a policy that everyone knows, well, it's a policy. They don't just implement it on me because my skin color is different or my religion is different or whatnot. They implement it because it is a policy. So this helps a lot, but it also helps people know what to do. When you have a policy, then people are held accountable to that policy, as opposed to when you just leave things, and everyone just does what they want. Positive disciplinary style. So think about positive feedback, positive discipline. A lot of times when I talk to parents about discipline, and I'm a parent too, I always ask myself the same question. How many times do we tell our child, do we catch them doing good things? What do we do as parents? You did not do your homework. You did not listen. You are sitting awkwardly. You are doing this or that, right? How many times? Let's, try this yourself if you have kids or in a classroom. Keep a log of how many times you point their attention to something negative they did or something they did not do that they were supposed to. Just keep a log. And how many times do we notice when they do a good thing? How many times does the child, do you compliment the child for, sitting quietly and doing their homework? It almost feels awkward, like, you compliment the child for doing what they're supposed to. But think about this, and I think this is, very obvious. So when you keep criticizing the child all the time, and maybe let's think of a child who is what we call higher maintenance, a child who needs more help or more attention. Okay? So all the time at school, he's hearing the teacher saying, you don't do this, you're not delivering, you're not doing your homework, you're not listening, you're not. They go home and they hear the same things from their parents. How do they feel about themselves? And does this work, right? Even worse than that, we start saying things like, you're a bad kid, you're horrible, you never listen, you never do this or that. Or even, even more aggressive ways of disciplining children, whether physical or other ways. So when you tell your child, you're a bad kid, we say in Arabic all the time, أنت ولد وحش, right? I mean, it's something we hear a lot growing up. What does this message give to the child? You're a bad kid. Okay, well, I'm a bad kid. Khalas, I'm a bad kid. I'll do what I want. I mean, I'm already a bad kid. So it's very important to distinguish between the child and the behavior. So the right thing to say, and this is something I have to remind myself too of it. I mean, I think it's a trap we all fall into. We have to catch them doing good things, right? Catch your child doing good things, not only doing bad things. But the other thing is criticize the behavior, not the child. You are a good child, you did a bad thing. Your behavior was bad. You did a mistake. You should do it differently. But that's a very different message than you are a bad child. Think about the two different messages. If I did a mistake, I know I can correct my mistake. If I'm a bad child, khalas, I'm done. I'm a bad child. What are you talking about? I might as well continue being what I am. I mean, that's just me now. I'm a bad child. So think about these messages repetitively being drilled into children's mind as they grow up. Students are involved and given responsibility in some aspects. Frequent assessments of student progress is made. High academic expectations. We expect from them to deliver academically. Focusing, but not only focusing on academics, extracurricular activities, sports, everything. You want a well-rounded child, graduating from high school and being ready to lead on, prosperous adult life. Okay, so this is the last section. I want to talk a little bit about the core values of a mental health promoting school. And this is not supposed to be an all-inclusive list, like, these are all the values in the world that you need to have, a good school from an emotional or mental health perspective. But I thought about some of the things that should be part of the formula, and also how to make them practical. Like, what are the changes that we could do within our educational setting to promote some of these things? So the first one, caring for all. So it is important to foster an environment that is understanding and view students who have difficulties as those of need for help, not just a burden. They are not just that troubled child that now is signing up for your classroom. But this is a child, even with their trouble, if you want to call it trouble, is actually adding something to your classroom. And hopefully we can get a chance to talk about this a little bit more. So what can we do to promote an environment that is caring for all? So, if you want to kind of even take a few seconds to think about each one of these aspects and how you could implement them. But here are some of the ideas. Communicating through actions that all students are valuable. Actions speak much louder than words, right? We tell children things all the time, but if we do not follow them, if we do not value that child who has some disability in our classroom, do you think the other students will? They won't. And you might say we value this child, but if every time you're seeing that child, you're frowning or you're upset or you're worried because you're going to have to, make a lot of effort, what message does that promote for the other children? Creating an environment that does not discriminate. Look, we're humans. We all have biases. This is something that we know. We all have, things, that have been drilled on us, hardwired, that are biases. And there's a lot of studies to prove that. I mean, a lot of us, if we ask ourselves, oh, do you think you're a biased person? I'd imagine 100% of us would say, no, we're not. But we are all biased, and this is actually natural. Being biased is different than discriminating, right? So we all have our preferences, our biases, and a lot of them are cognitive, hardwired, a lot of them we are not aware of. But at the same time, being biased does not equal discrimination, right? So you might have preferences of any kind, but you should not discriminate. And actually, it's important for us to understand our biases, because a lot of them are not at the conscious level, at the unconscious level. So trying to think, introspect more and think more about what biases could we have, and being non-defensive about it. I don't remember the exact website, but there is a professor at Harvard of psychology who had a very interesting program. It's a computer program. I mean, I think if you Google it, I just don't remember the details. But basically, it revolves. I took this test, and a lot of people all over the world took this test. Anybody could take it. But it's really a test of subtle preferences, showing pictures of different things. And they do it in a way that is very subtle, that you don't notice a pattern. So, showing you pictures of, children of different colors, showing you, all types of diversity. And just, seeing how you respond to the different pictures, and they'll present you at the end the report of your biases. You would be very surprised. We all do have biases. A lot of times we're just not aware of them. Or we are aware of them but do not want to face them. So creating a mechanism that deals with complaints. This is again back to policies and procedures. When there is a complaint from a child or from a parent, do you have a formal policy? Who do they go to? Do they go to the teacher first? Do they go to the principal right away? So what is your policy about that? Okay, valuing diversity. I feel like we've already talked about this a lot. But let's just summarize some of the points. Teachers need to communicate positive attitudes to children with special needs so that the other students would follow, right? If you are sending them the wrong messages, they will follow your lead. And if you're also sending them the right messages, they will follow your lead. How can we promote diversity? Establishing a buddy system. So, if you have a child who's, say, new to the classroom. So you started the year and the child had relocated and they're starting in the middle of the year. They are different, right? They're different just by the virtue that they're new. So can you establish a buddy system? Can you establish another child who would kind of be an acquaintance for this child as they kind of get used to the new school environment? But if you have a child with a disability, can you have a buddy who is willing to help or support that child? Having students with special educational needs in mainstream classrooms has a positive impact on other students, particularly in the area of developing social skills. So having a child with an impairment in your classroom, as challenging as that could sometimes be, actually has a positive effect on the other children. They learn skills that they may not have learned otherwise. There are some studies, I know for physicians, but I'm sure that's true for other helping professions, probably teachers, where that they've seen that people who have a brother or a sister who has grown up with a disorder, a mental disorder, a disability, a physical disorder, are more likely to end up going to helping professions. They are actually more likely to end up, say, being doctors, because it makes sense. When you see somebody who needs help, that hits a very soft spot for all of us. And having children with disability in the classroom is really important for the other students. It could be challenging. I would not argue against that. But it actually helps them learn skills that they may not otherwise learn. And even it might guide their life to directions that they may have not otherwise taken. They could become teachers because they saw you teaching the student and treating them with respect and with care and with empathy. So just think about some of these things and the messages these issues send to the children. Building self-esteem. So being in situations where children are constantly being criticized or experiencing failure, as we said before, does not lead to a good emotional or mental health state, and certainly does not build their self-esteem. And schools have a very big role in building self-esteem in students. So what are some of the things that we could do? So there's a lot of activities, and there's actually a lot of websites. There's a website called connectability.ca. It's a Canadian website that actually has activities that you could implement to help promote self-esteem. But let's think about some of the activities for older kids and some of the activities for younger kids. So for older kids, giving them responsibility and leadership roles when possible. Giving them the chance to organize things, to have a say. If you have a student government, great. You have natural leadership. But you may not have, that format, but there's a lot of things. You're organizing a trip. A teacher can organize a trip, but if you have a 15-year-old, they can organize a trip possibly better than you can. So involve them, at least involve them in the organization, and give them leadership roles, responsibility roles. Use of praise rather than reprimand, as we mentioned before. Foster cooperation rather than competition. And when I presented part of this in Arabic yesterday, someone asked a very good question. Competition is healthy, but there's also unhealthy forms of competition. So you want people to compete, but you also want to be thinking about the ways they compete and what are they competing in. So for younger children, there are also a lot of activities. As I said, there's this website that you can look at some of the activities in. But you can do things like I'm special book, have the children write about why they're special, things I'm good at, create my hand activities. A lot of you, particularly in the very early education, would be familiar with it. You have the children all trace their hands, and then in each finger, write one thing they're good at. I am sweet, I am nice, I am good at soccer. And have them think about what they're good at, and have them talk about what they're good at, and just hang this on the walls. Imagine what the messages these things send, particularly for children in the very early stage. This is not an activity for 15-year-old. They'll be laughing at you if you offer this as an activity, but this is a very good activity for a 5 or a 6-year-old. Have them think about what they're good at, so it helps them think and promote their self-esteem, but also helps them talk about themselves and help other people give them feedback and develop some social skills. Use scripted role plays with puppets to develop feelings of self-esteem by brainstorming ideas. So we all know, particularly those of us who work with the younger kids, that a lot of the work that happens is in displacement. What does displacement do? Displacement is really, helping the children express their thoughts or feelings in a less intrusive way. Puppets is great. It's so much easier for me to, as a child, to have a figure I'm holding in my hand or a puppet that is talking about how bad they feel because their parents are hitting them at home than for me to sit here and tell an adult my parents are hitting me at home. So this happens in displacement, and this is why therapists who work with children, particularly the very young children, use a lot of methods. We don't sit with a 6-year-old and tell me about the abusive relationships that you have experienced. We'll tell them, draw something for me. What is your home environment like? Just draw it for me. A lot of things will come out in displacement than they will come out by asking for them in a traditional way. Other ideas, you could use beads, and each bead represents, a positive thing, and again, encouraging them to talk about it. How about promoting or building relationships? So group activities are a very good way to build relationships. Procedures should be in play for teachers to manage potential differences with colleagues and students. So while you should promote team approach, collaborative approach, you also know that kids don't always get along. And when you're giving them a group activity, they might start disagreeing or fighting. So you need to provide them with forums for teamwork, but also provide opportunities for them to learn how to manage conflict, but for you to intervene if they're not managing conflict effectively. Ensuring safety. It's very important to have a safe environment at school. And unfortunately, this is an issue that we struggle with worldwide. I mean, if you think about the epidemic of school shootings in the US, I mean, you can't even keep track of the names now, Sandy Hook, I don't know what, like every really few days there's a mass shooting in the US. And this is obviously one aspect of safety, but there are a lot of other aspects of safety. Bullying. This is a huge problem in the US, huge problem here. A lot of bullying happens in school. Or even, thinking about, some of the countries in the region. I mentioned earlier in Gaza, the post-traumatic stress disorder in children is thought to be about 40%. And unfortunately, it's one of the places where it's least possible to help the people. You know why? Because with post-traumatic stress disorder, the biggest predictor of being able to recover from trauma is safety. If you never achieve safety, if you keep being re-traumatized all the time, how will you heal? Right? I mean, if every year or two there's another war, another whatever, it's so hard for the children to heal. Sometimes there's nothing we could do about it. We cannot always control, the very unfortunate political situation or political reality, terrorism, everything we live in these days. But at least let's see what we could do to make the environment safe. Physically safe, but emotionally safe. Emotionally safe means people can talk. It's okay to say that you're stressed. It's okay to say that I may have had a thought of killing myself. Well, yes, it's a taboo and it's a stigma, but guess what? If you don't talk about it, it doesn't change anything. The only thing it changes is that they're more likely to do something about it because they do not feel safe talking to you about it. Aggressive behaviors may threaten students and cause them to withdraw. So there's two types of responses to trauma. Some people withdraw and some people actually become themselves. So a lot of people who are being bullied can become bullies themselves, right? So there's people who withdraw in the face of trauma or unsafe situation. There are people who become more aggressive in the face of threatening situations. So establish a school-wide policy for bullying. So bullying is a big issue and you need to have a plan. What is our plan when there is an incident of bullying at school? It's very complicated. I mean, we struggle with this so much in the US. There's no one, a lot of times I get this question, okay, so you're talking about bullying. So what should we do about bullying? The answer is we don't really know. We don't really know. I mean, there are a lot of ideas, a lot of examples, and a lot of things that, we could recommend. But the idea is have a plan. Think about a plan. Develop a plan and work on that plan. Any form of threatening behavior needs to be dealt with rapidly and effectively. Zero tolerance is really important. While we now, could be very clear about, okay, nobody can get physical, nobody can hit, the students cannot hit each other or bully each other, but it's not, we all know it's not that easy because we're seeing a lot of other issues. What about emotional bullying at school? So how do you deal with that? What about cyberbullying? It's a huge issue. A lot of the students who, there's been, some very well-known cases in the US of students who commit suicide really based on cyberbullying. So what could we do as schools? Do we have a role as schools? Or is this a law enforcement issue? So, and do we work collaboratively? How do you approach these things? We need to be thinking about these things. We may not always have the right answer, but if we're at least thinking and testing things and developing things, at least at some point we will have that right answer. Ensuring that teachers and staff are approachable is really important. People do not talk to problems to people they do not trust, no matter how big the problem is. If you're a teacher they do not trust, they're not going to mention anything to you, even if it's really important or really germane. Encouraging participation. The most effective schools are those that create a positive atmosphere. Effective participation is facilitated with school staff actively consulting with students and their parents. Students are more likely to cooperate with regulations that they have a say in developing. This is true for kids, it's true for us as adults. If you're a teacher at school, are you more likely to follow a policy that you were consulted on, or just a policy that someone just wrote up and sent you, right? So a consultative approach is really important. And I'm not saying that, of course it has to be age appropriate. I'm not saying that to say, oh, okay, it's like, ask the 14-year-olds if they want to do homework or not. Let's have a democracy. If they say they don't want homework, they're not getting homework. No, that's not what we're promoting here. We're promoting that, with some opportunities, if there are different options and all the options are viable to you, options make sense to you. So, if we're going on a trip, do you go to this place or that place? That could be a really nice thing to have the students have a say in. But even other examples, even with the younger kids, you might be surprised if you bring a group of 6-year-olds and tell them if they want to set certain policies between them about respect, about taking turn, right? You might be surprised that even 6-year-olds do have a sense of equality, and they do understand that, although I want to play with all the toys, but it's okay for the other child to get a chance. And if they think about some of these things and actually be part of developing the policies, they are more likely to follow them. They may not follow them 100%, but believe me, if they had a say in this policy, or it makes sense to them, they're more likely to follow it than if they had no say whatsoever. Okay, how do you promote participation in schools? Allowing students a say in running the schools, such as student council, student government, if that's available in your school. Displaying students' work and calling attention to their achievements. I think mostly we do a very good job with that, particularly with the younger kids. Hanging stuff on the walls, making them feel proud of their work, they write their name. With the middle school students, maybe activities like, writing something about me type of activities. So, they come up with a poster that talks about, things they like, a little bit about their family, how many brothers and sisters they have, those types of activities. Ensuring parental involvement is very important. Fostering independence. I mean, one of the main goals of schools is to, have basically graduate people who are ready to be independent and responsible, right? We want, by the time people are starting college and they're 18, that they're independent and capable of moving on with their lives. Learning is more effective when students are encouraged to think for themselves. How can we foster independence? Students should be given age-appropriate tasks, and we talked about some of that. Provide opportunities to share views, just creating an environment where people can share their views, have a say, ask questions. Provide programs that develop leadership, encourage debate, and improve negotiation. And there are a lot of examples. I know some of the schools here in Jordan employ some of these programs, like the Model United Nations programs, but there are other programs. Just the idea that people have forums where they can debate. Sometimes you have debate clubs, take leadership roles, negotiate, all these things. Early identification and intervention. So we also have to have procedures for, we've been talking about things that are good for people in general, but what about people who need special help? What is our procedure for early identification? The dilemma we always have with early identification is the risk of labeling. So on one side, we do not want to be labeling people, right? And a lot of times as teachers, that's not our role, not what we're trained for, not what we're good at. So you don't want to be labeling people. But at the same time, you want to be identifying people who need help and need support so that once you identify them, you can work with their parents around getting them help. But it is a balance, and there's no right answer. Some people can be very aggressive about, identifying people who, I think, these 5 kids have ADHD, and someone else could be very passive. Like even if they think there's a problem, they don't bring it to the parents' attention or try to do anything about it. There should be a a balance that you strike between the two opposing issues. Schools should have policies and procedures. So again, policies and procedures about early identification and referrals. So in your school, if you have a problem, a child who has a problem, who do you go to? Do you have a policy? Like, do you ask the principal? Do you ask the school psychologist? Do you have a school psychologist? Do you have a mental health counselor in your school? Do you have a referral system? So the child needs educational testing or neuropsychological evaluation. Who is it that you send it to? Do you just ask randomly some of your friends who they sent it to before? you should establish some of these policies and procedures, and this is partly the role of the administration to help support you with that. It could be hard at times to determine to what extent is a behavior problematic, and there's no question about this. I mean, even as a psychiatrist who I practice clinically, I do other things, but I mostly practice clinically. A lot of times I do not know the answer. Someone sends me a 6-year-old child with a question, is this child psychotic? The child might be, responding to characters, imaginary friends that are not there. A lot of times I do not know the answer too, because, there are developmental challenges. So a child who's 5 or 6 could be still having an imaginary friend. Typically they do, or, they have Superman who visited them yesterday night. Is this a psychotic child, or is this a typical 5-year-old child? So, not to sound reductionistic, of course, there are other things that help us make the determination, because we also know what is age appropriate. So 15-year-old who saw Spider-Man yesterday is very different than a 5-year-old who thinks he saw Spider-Man yesterday, right? So there's way to sort out these questions, but what I'm trying to say here is that the answers are not always clear. This is true for professionals, but it's even more true for teachers. So a 5-year-old in your classroom who's hyperactive, are they like every other 5-year-old because 5-year-olds are hyperactive? Or is this a child who has ADHD? So how do you know? You may not know, but you should know what to look for. You should know when to seek help. And I think, what helps, when teachers ask me, like, so how can I know? I think two things could help you. One is that you guys are very good experts in age normness, right? If you're a kindergarten teacher, you've seen a lot of kindergartners. If you think about how many years you've been teaching, every year, how many did you see? You actually are good with norms. So if you have a 5-year-old, and you're not sure, well, first question is like, how does it compare to every other 5-year-old that you've taught? So 5-year-olds are hyperactive, but if you have a 5-year-old that out of the 1,000 students that you've taught in your 15-year career in teaching, there is this particular kid who stands out, there's probably something there. You may not always be right, but this is a child where you really want to consider sending them for a referral. Another thing is also functional level. So I could be an anxious person, right? A lot of us are anxious, and anxiety is actually normal, at least to some degree. But, if I'm an anxious person, now I cannot go to my work, I cannot function, that's a problem. If I'm an anxious person, but, I pull it together, I come to my work, I do my job, no problems, it's less of a problem. And the same is true for children. You may have a somewhat hyperactive child, but if it's not affecting their function, if they're still learning okay, if they're not particularly disruptive, if they're not causing problems in your classroom, then I'm less inclined to really call it a problem. Okay, this is the last point. I think we're doing just barely okay with time. Support and training for teachers and other staff. Really important. This is what we have been, trying to do here, and I'm so glad that in this forum and with the Queen Rania Teachers Academy that I've been working with for a few years, they've been really trying to implement these, emotional health, mental health within their programming, because this is really important. And we've provided forums through QRTA, whether during this conference or in other activities before, where we're working closely with teachers. We're learning from teachers, but also thinking collaboratively of how to support children who have these needs. But teacher training in these aspects is very important. I do a lot of these trainings in the US, but the system there is different. So there is continuing education credits. I don't know if that's true here, but actually as part of your continued development, professional development as a teacher, you need to cover some courses, whether related to child development or child mental health, these types of activities. So, because essentially it's not just to make people's life hard by having one more professional development thing that I have to do, but this is really important for your classroom. This, at the end of the day, this is for you and for your management of your own classroom. Working with children with mental health problems can be very challenging, and we said this is the primary reason for burnout for teachers. Workload and student behavior were found to be significant predictors of depression in teachers. Clinical depression in teachers is related to some of these things. A teacher who is overwhelmed has more difficulty supporting their students. If your emotional health yourself is being affected, you're less likely to be able to be available for your students. So what do we do here? Create a culture that encourages teachers to discuss difficulties. And again, I think the challenge of some of these issues is the stigma. Not just the stigma with the students, but the stigma between the teachers. A lot of teachers find it difficult to go and say, look, I'm struggling with this. And I see this more even with the younger teachers. I mean, it's really true in all professions. I mean, younger doctors usually have more self-doubt than older doctors who think they know everything. The younger doctors might still know even more than the older doctors. But anyways, it's true for teachers, true in all professions. But I see that a lot of the younger teachers, at the start of their career, they have doubts. I mean, think about it. Imagine this is the first classroom you ever taught. You finished your university degree, you're excited now, your life mission is coming to it's developing and you're seeing it. Now it's my first classroom, I'm going to change the world. And guess what? You have a difficult classroom. You have a few kids with a lot of conduct problems, behavior problems, and your life is falling apart. This is your first experience. You start doubting, maybe because I'm a young teacher, maybe because I don't have a lot of experience, maybe if this was 10 years later, I would have dealt with it better. So what do? You can become depressed, you can not talk to anybody, you don't want to go to the principal because the principal doesn't know you, they might think, they're the new kid on the block, maybe they don't know they just don't know how to manage. So you find yourself dealing with a very significant problem, internalizing it and not being able to share it with anybody. So it's very important to be aware of that. I think this is, again, about the culture. If your principal is aware of that and they actually reach out to you, and if your other teachers, colleagues reach out to you in the beginning and just ask how things are going, you might have opportunities to brainstorm with them, pick their brains on, talking about like, how do you manage disruptive behavior in classrooms? So establishing a teacher support system, whether formally or informally, even buddy system between the teachers, helping teachers reconnect with the reasons they became educators. One thing about teachers, you don't do this for the money, because obviously there would be a lot of other professions that would be more rewarding financially. So what are the reasons you're doing this? And reconnecting with these reasons, particularly when things are not going well, are really important. Help creating an environment that is positive and supports development, training and behavior management techniques. This is very important, that there be formal training in how to manage, just any classroom setting, basically. Helping teachers understand that difficult behavior by children may be a cover-up for circumstances that the child is experiencing. We're humans, we take things personally. We all do, right? If someone does something that bothers me, I'm very likely to take it personally and think, they don't like me, and next thing I could come up with maybe 100 reasons why they don't like me. I'm not too tall, or I'm too tall, I'm fat, I'm not fat, my skin color, the way I speak, my religion, my race. We can come up with like 2 million reasons why people may not like us. But it's really important to know that with disruptive behaviors in classrooms, a lot of times it's not personal. You do not know if this child is being abused at home, being beaten every single day, and they're coming to your classroom, and this is the only forum where they're letting out their angry feelings because they cannot do it in the classroom. And you would sit there and you would take it very personally, and I'm not blaming you because we all do. We are humans, we take things personally, right? But it's important to remind ourselves that a lot of times it's not about us, it's actually about them and what they're going through. So this is important to keep in mind. So we're out of time. I want to just end with this really wonderful African proverb. If you want to go fast, go alone. If you want to go far, go together. Thank you. These are some of the references that we used. And these are some of my contact information, my email, and contact on social media. And thank you all for your patience.